I am William Sutherland. I'm an orthopedic surgeon. I have a specialty in spine surgery. No one else in our practice does spine surgery, and so I do all of that. So probably a good half of the practice is spine, and joint replacements, knees and hips, fractures, and in general orthopedics. Probably the most exciting improvements have been in robotic assisted surgeries, which is just fantastic, because you end up with a component in exactly the right spot, and it's really exciting to see. The motion is wonderful, the stability is wonderful, and so that advancement is I think tremendous. Every year there's something that's more, something that's better, something that's improved. I think that in spine surgery, incisions are smaller, microscopes are better, and people are often getting surgeries that, instead of staying for 3 or 4 days, many of them are day surgeries, and they go home the same day. I like working with my hands, which is important in orthopedics. Growing up, I'd be with my dad, who would teach me all kinds of carpentry things, and I just would love it. So some of that is similar in orthopedics, and you have to like it. Putting fractures together and putting a plate on and screws and lining it up well, it's very satisfying. And if it was just that, I don't think I'd like it, but you get to deal with the people and to talk with them, and the people are of all ages. I like the fact that one minute you could be with someone who's 2, who broke their clavicle, and the next minute you could be with somebody who's post-op from their hip fracture surgery, who's 92. My philosophy is that the patient is the most important person in the room. They came for a reason. They came for an issue, a problem, and it's multifaceted. Many times I'll see someone that they'll say at the end, "Well, thank you for listening," and I haven't heard someone listen that much before. And I think that if you do that, you can understand the problem better and be able to treat it better. And then when you see the result of something like an improvement with this therapy or an improvement with this surgery, and to just see how they came in and then see how they end up at the end, it's certainly very gratifying.